Parents across the country are reporting high levels of stress and burnout, and the U.S. Surgeon General says it's becoming a public health concern. Joining us now to explain more about this advisory is Psychologist Dr. Lynn Bufka. Lynn, good morning. Thank you so much for your time this morning.
Good morning. I'm glad to be here.
In your experience, what are the primary sources of stress when we talk about this anxiety for parents today?
Yeah, there's a lot of things that parents are stressed about. We've always been stressed about finances and how are we going to manage our time, children's health and children's safety. But you add in now questions around what's the appropriate use of social media? How has changes in schooling impacted our kids? What happens with lots of parents are reporting being very concerned about gun violence in schools. So there's a lot of additional stressors on top of the demands that many parents have. Many parents are working, both parents are working, and time is limited. And how do you do best for your kids?
And those demands, that's something parents have always had to budget. But as you mentioned, on top of those stresses are additional influences from our environment today.
Absolutely. And part of the challenge is all of us are seeing sort of what ideal parents look like on social media, right? But none of us are ideal. So trying to figure out what's really good parenting can be tough when the images you see are often of perfection. I love the pictures you're showing because this is what good parenting looks like. Spending time with your kids, but the house can be a little messy.
Right, yeah.
And it's not perfect.
Yeah, that quality time really makes up for that mess. Talk to us. I want to ask you, so this advisory mentions the well-being of parents is directly linked to the well-being of children. Explain to us how parental stress can affect or impact children's mental and emotional health. There's a direct correlation here.
Absolutely. Children are very tuned in to their parents' well-being. They know if mom and dad are feeling stressed out and overwhelmed, but they don't necessarily know why. And they may think it's because of them. And so then they might try to change situation, act up, change their behavior in ways that aren't necessarily healthy. But even if they do, even if the parents are saying, hey, I'm just a little overwhelmed with stuff, it's nothing to do with you, the kids may feel guilty for taking more time on parents' demands. And it can definitely have an impact both because of the experience of distress in the home and also the relationship of parents who are more prone to being more distressed biologically may also have children who are more prone to being distressed. So it can build in that way as well.
Yeah, and you said that really well. You know, children are extremely cognizant, right? They're very aware. Whether they say so or not, they're going to be picking up on these stresses. And then to add on top of that stress, if they're not expressing their stress or the idea of them picking up on what it is you're feeling can just lead to bigger problems down the road.
Absolutely. If we talk to our kids about what's going on and let them know that they're not the source of our distress and that mom and dad or grandma and grandpa, whoever's taking care of the kids, is letting them know we're doing our best to handle things. And here's what is best for you. I love it when you give me a hug. It's great when we can just play go fish together. It's really helpful when you pick up your toys when you're done playing, things that are age appropriate for our kids, to let them know how they can contribute to the overall well-being of the household.
So the Surgeon General mentions a culture of comparison, often driven by social media. Have you seen this contributing to increased stress and anxiety among parents and perhaps, again, passed on to their children?
So I don't have data to talk about in that regard, but certainly we've seen that when you look at social media. I often will talk with patients and colleagues about, limit what you're looking at. Don't think that that ideal picture that you're seeing online is what's actually happening in people's homes. Understand what reality looks like. And I think it's really helpful for people to look at their expectations around how they parent and really try to focus on what are their goals as parents and what's important to them, and not spend as much time on, are my kids going to the best school? Have they done 3 different kinds of extracurricular activities? Those kinds of things.
So often we give attention to the impact social media has on children, but I think re-examining the impact that it has on parents is also crucial. It's really critical.
Absolutely.
Yeah. Talk to us about the role healthcare providers can play in screening for parental stress and anxiety? We're talking about routine visits and other resources. Elaborate on that.
Sure. I mean, healthcare providers are a great source of contact for parents, and just asking them, how are things going? And being aware of what's available in the local community. Most of us, our primary care provider is going to be our input in our entryway to healthcare. So that's a great place to say, how are things going with the kids? Anything you need to talk about there? It's great when behavioral health providers are connected into healthcare settings, because then you can just talk to somebody right down the hall who has the expertise. Lots of places don't have that, though. So the more that we can do to build resources in our community, to have accurate information about child development, what's normal child development, and how we can help parents meet age-appropriate goals for their kids is great to do. So when healthcare providers are able to do that and talk with parents how satisfying their own well-being is going to help them be better parents for their kids, that's a great start.
And I think as a society, we began prioritizing that work-life balance in recent years. Talk to us, though, elaborate a little bit on how workplaces can better support parents when it comes to managing these types of stresses and anxieties.
Oh, absolutely. Workplaces can do a lot to support parents, whether it's having flexible work schedules, having capacity for childcare on site, or flexible spending plans that help parents put pre-tax dollars to childcare, whether it's allowing time off for when a kid is sick or when there's events that parents need to be at in order to support their kids. Work can get done in different ways. It doesn't have to be punch in at 9, punch out at 6, you have an hour for lunch. And so being flexible about that with parents allows them to bring their best selves to work and also be able to parent in ways that works for their family.
And then, of course, that contributes to a happier work life as well.
Absolutely.
Okay, Dr. Lynn Bufka, always a pleasure chatting with you. Thank you so much for your expertise.
Glad to be here. Thank you.